Hi everyone. So today's topic for the MDS finish line is on trigeminal nerve and its applied aspects. So the facial and the trigeminal nerve are equally important. They can be asked as essays. So the contents, as I said, they are very important. So first you have to write these contents for this trigeminal nerve. So again, under individual content, you can give a sub headings, like for example under anatomy you can give the headings like ganglion, the branches and the nuclei of the trigeminal nerve. Okay, and again under examination you can give the subheadings like the history taking and the examination and the physical examination, like that you can give. And under the clinical aspects, what are the diseases that you are going to cover, for example the trigeminal neuralgia, so you can give the subheadings like the clinical features, the management. So like that you can even give the subheadings, but these are the main contents that you have to cover. So coming to the trigeminal nerve, if it comes an essay, so you can write the other cranial nerves, you can just name the other cranial nerves, followed by which you can write the introduction for the trigeminal nerve. So we can call it as a fifth cranial nerve, which is one of the largest, and trigeminal means three, so it has main three branches or three major branches, which are the ophthalmic, the maxillary and the mandibular. Okay, so coming to the next heading, that is a nuclei. You have to write the nucleus which come under, or which is trigeminal nerve has. So it has three units, that is a motor nucleus, the sensory mesencephalic nucleus, and the third one is the sensor nuclear complex, which is again divided as two distinct nuclei, that is the main sensory nucleus and the nucleus of the spinal tract. So you can put this diagram there where it is showing the mesencephalic nucleus and the primary sensory nucleus, okay, as shown in the picture. So you can put this diagram. So diagrammatic representation is very important, and even you can draw the spinal nucleus, which is at this rostral end, you can see. So the blue thing is a spinal nucleus, even you can draw like that. And the GASSERIAN or the trigeminal ganglion, which is a crescent shaped structure, you can draw showing the three main branches. So you can draw this small diagram, it is like scoring for you. Okay, so again coming to the individual nuclei, you can just give a bit of description of the individual nuclei, as in the motor nuclei where the two principal muscles have been involved, like the masseter and the temporal. And coming to the mesencephalic nuclei, where it consists of a mesencephalic nucleus which is unipolar, and most of these are proprioceptive in function with receptive terminals responding to the stretch of the muscles of mastication. Okay, so you can give slight description of these nuclei, okay, as given here, so that to increase the bulk of the answer. If it comes as a 20 marks question, then you have to increase the answer by giving extra points like this. The main thing is you have to give good headings. Okay, so these diagrams and headings are equally important. So coming to the next part is a trigeminal root. This root again consists of like the sensory and the motor divisions, which are seen as a separate roots. As you can see in the picture, there are two separate roots. Okay, these are again supplied by the group of vessels which are called as a trigeminal arteries. So you can give this small diagram if you want. So next coming to its ganglion, the ganglion for the trigeminal nerve is a GASSERIAN ganglion, whereas for the facial nerve is a geniculate ganglion. That is simple, you have to remember. So this ganglion, again you can give a description for that it is crescent shaped, it lies in the Meckel's cave, it lies on the anterosuperior surface of the petrous bone. It is an expansion of the proximal sensory artery or sensory root. Okay, so like that, and it is surrounded by arachnoid and dura mater. So all these important points related to GASSERIAN ganglion you can give, because GASSERIAN ganglion again can be asked as a simple very short answer. So you have to put this diagram, you can give little explanation. Again, if it comes as very short also, this small thing is not enough, then you have to add the other important aspects of trigeminal nerve. So putting this diagram will be very important and fetching for the very short, so have a note of this. So especially you have to write this part, that it is surrounded by arachnoid and dura mater as shown in the picture, so you can highlight that. Okay, and also it lies in the anterosuperior surface of the petrous bone. So all these points if you have to put in there. So coming to the main branches, it is trigeminal, so it has three main branches, that is the ophthalmic, the maxillary and the mandibular. So after writing the Gasserian ganglion, if the Gasserian ganglion individually comes as a question, then again you can write these nerves, because you can write that this ophthalmic nerve arises from the anteromedial aspect of the Gasserian ganglion. So, like that you can extend your answer. So, this point will be fetching there again. Okay, the branches of the ophthalmic nerve are these three, that is lacrimal, the frontal and the nasociliary. So, this diagram you can put in. Okay, what all diagrams you can draw from your Chaurashia textbook, all those diagrams if you put in there, it will be very much fetching for the score. Okay, so anyways, the examiner will look how you have presented well. So, it depends on how nicely headings you have put and what all diagrams you have included, especially like anatomy related questions. So, you can write draw these diagrams if you can. Next, coming to the lacrimal nerve. So, you have to write the course of how it passes, and again before entering to the gland it has divided into two. Okay, so like that you can put. So, it supplies the lacrimal gland again. So, next coming to the frontal nerve. So, the frontal nerve, it gives off again two main small branches, that is supratrochlear and supraorbital. So, like in the middle of the orbit it gives these two. So, as you can see in this diagram. Okay, so that you can put in there. Next, coming to the nasociliary, it is a nerve for the sensory supply to the eye. So, it is for the sensory supply. Okay, apart from that, these branches are the long and sensory root, the long ciliary nerves, the infratrochlear nerve and the nasal branches. So, the frontal nerve is supratrochlear, whereas infratrochlear comes under nasociliary. So, these points you have to put in again. So, individual branches of those individual nerves of that particular division you have to write. You can't simply end up with ophthalmic division, and you can't simply give those three branches and go to the next division. If you write again the individual in a nice flow chart, and if you put a diagram there, it will be fetching. Okay, next coming to the maxillary, it is a purely sensory division. It's completely sensory and it arises from the frontal central portion of the Gasserian ganglion. Okay, so that point you have to highlight if you get a question on Gasserian ganglion again. So, the most important branches is the middle meningeal nerve, as you can see. So, it's a middle meningeal nerve is the most this, and it again passes through the foramen rotundum. So, as we know, this was an important question in a PG preparation. So, this passes through the foramen rotundum. So, again it has two other branches, a zygomatic nerve in turn, that is zygomaticofacial and zygomaticotemporal. So, these points you have to put in there. Okay, and later you have to see that it travels through the inferior orbital fissure into the orbit, which becomes a inferior orbital nerve, infraorbital nerve, which exits from the infraorbital foramen. So, all the course if you write, it will be even more fetching if it comes for 20 marks. So, we are done with ophthalmic and the maxillary nerve. So, you have to write the detailed course. So, the points which I have shown, you can just make a small notes of it, that's enough. So, coming to the last division is the mandibular. It contains both sensory as well as the motor. Okay, so it is formed by a large sensory root from the Gasserian ganglion that has passed inferiorly through the motor root of the trigeminal nerve. These pass through the foramen ovale. Okay, that one maxillary passes through foramen rotundum. Here it passes through foramen ovale. Okay, again it has anterior and the posterior division. So, what all muscles and what all the things what are the structures it innervates, we have to write. So, these muscles which included in the anterior division are the branch to the lateral pterygoid, to the masseter, to deep temporal and the buccinator. So, all these you have to write. These are the structures that have been innervated by this nerve. Then the posterior division, again you have to give this auriculotemporal, the lingual and the inferior alveolar nerve. So, these points you have to put in, and again what are the importance of the individual branch, if you write, it was even more fetching. Okay, so we know the lingual nerve and the inferior nerve, which inferior nerve almost supplies all the teeth and of the lower jaw. So, again it gives off through branches at the like mental foramen, mental nerve, and again in the incisive foramen it gives incisive branches. So, all that in detail if you describe, that's more fetching. Okay, so auriculotemporal nerve, you can see in structures being innervated, that is upper part of lateral surface of the ear, upper part of the meatus, the tympanic membrane, the parotid gland and the skin of side of the face. Okay, the lingual nerve is for the sensation to the gums and the anterior portion of the tongue, whereas inferior alveolar nerve, it has 3 branches, that is the mylohyoid nerve giving to the mylohyoid muscle and the anterior belly of digastric. Posterior belly of digastric is bifacial nerve. Okay. Next, the inferior dental plexus to the gums and the teeth of the mandible, whereas the mental nerve is for the skin of the chin and skin of the mucous membrane of the lower lip and the gum. So, all these innervations you have to write so that it increases your answer. So, coming to the examination, so we have done with the GASSERIAN ganglion, we have done with the nuclei, the trigeminal nerve and the individual branches, or individual divisions along with the individual branches and the structures being innervated by those branches. So, this is just the outline I am giving. So, these headings, they have to fall in, and then you can give your own detailed description along with the diagrams. If you give, it is fetching. So, next coming to the how you examine. So, based on the history, if the patient is having any problem, or else you can just see for the sense of touch, you can just use a small pin, not a sharp thing, you can just use a small pin like structure to see for the sensations. Okay, and also for the corneal sensations you can see. Next, for the motor function, you can see the strength of the muscles, especially the masseter, the temporalis and the pterygoid. You can ask the patient to open, close the mouth and give the lateral exertion movements and all that. By that you can see the test for the motor function. So, coming to the clinical aspects, so the most important disease or the condition which is associated with the trigeminal nerve, which every department student has to write, is a trigeminal neuralgia. It is most important applied aspect you have to write irrespective of your department. So, especially for oral medicine, surgery and OPATH, it's equally important. So, write this for sure. So, what the exact condition, you have to write the definition which is given by the International Association of the Study of Pain, which is highlighted in this box. So, it's better you write the definition. Okay. And you have to write which of the division is more commonly involved. You can say the V3, that is mandibular division, is more commonly involved, followed by the other divisions. Okay, the etiology could be anything, so it is actually unknown, but it could be the compression of the nerve root. Okay, so it could be either by the compression caused by the superior cerebral artery on the V2 and V3, whereas anterior inferior cerebral artery on V1. Okay, this if you write, it's useful for the etiology point of view. Next, coming to the other, it could be the tumors or veins or any arteriovenous malformations can cause. So, the pathogenesis, if there is a compression, then there will be breakdown of the myelin which cause abnormal depolarization, and that results in ectopic impulses causing the pain. So, this is a small pathogenesis which you can put there. Coming to the clinical features, so you have to write these clinical features. We know the sudden stabbing, unilateral pain which is triggered by anything. It can be triggered by even exposure to cold air or washing the face or doing makeup or whatever. It is classically unilateral, sudden and stabbing type of pain. It has its own trigger zones. Okay, so these are the important findings that you have to write. And then the management, the pharmacological management, the most important or commonly given drug is the carbamazepine. So, the dosages, if you write, it's okay, or else you can give its major side effect. So, carbamazepine has a main side effect of causing a hematosuppression or a bone marrow suppression. That's the reason. Next, its analog or its more good version is oxcarbamazepine. So, though these are anticonvulsant drug, they act on the sodium voltage gated sodium channels, because of which they have been given in this trigeminal neuralgia. This has less of bone marrow suppression. So, oxcarbamazepine is now more given when compared to carbamazepine. So, now this is more commonly given as a drug of choice. So, both are almost the same. So, these are the dosages. If the oral medicine students can write, it will be useful for you. You can just keep this small box and write. And coming to the surgical aspects, so all these surgical aspects, if you put in, that's enough. And if you can individually describe, if you have time, if you can describe, that's enough, or else you can leave it. It's main, see, basics paper, they will mainly ask about the basic knowledge you have. So, you have to put in the anatomy and the if they ask anatomical point of view, you have to write anatomy point of view. If they ask in the physiological point of view, you have to write the physiology point of view, like that. So if you mainly put in those points, and applied aspects also do count marks. They have some 4 to 5 marks for the applied aspects, but the main clinical features of and the how you examine and minimum thing of management, if you write, you can fetch those marks as well. So that's it, students. And at the end, if you put if you can